Millions of people are living with Alzheimer's disease, and experts say the LGBTQ+ community among those with Alzheimer's face additional challenges.
Yeah, those challenges can be difficult to overcome. Our Lauren Edwards explains.
Being diagnosed with Alzheimer's can be scary for anyone, and when it happens in the LGBTQ+ community, people tell me that there's a number of hurdles and stigmas that they face, and over time, they say it really takes its toll.
We've been together 36 years, married 6. So we were fortunate enough to get married on our 30th anniversary.
A memory Roger Bushnell says he'll never forget. But now that Bushnell and his husband are getting older, they're starting to prepare for what's ahead.
I know myself, with my husband and I, we've been recently having quite a few discussions about making sure we're set up in the future.
Since they don't have children, it's a bit challenging, and having loved ones looked after them is not a possibility right now.
Because of some religious differences, shall I say, between my sister-in-law and my husband and I, the relationship was not built as strongly as I wish it would have been with my nieces and nephews.
It hurts, he says, but what they're experiencing is what many couples in the LGBTQ+ community are facing.
Historically, they have not had access to marriage, so they're less likely to be partnered. They're less likely to have children, and partners and children are very often our natural support system.
Kate Pierce, the director with the Alzheimer's Association, says everyone needs that nudge to go to the doctors. When you don't have that, diseases like Alzheimer's can't be detected early.
In fact, we have a higher risk of Alzheimer's and dementia than the general population, partially because we tend to have more issues with being overweight as we get older, hypertension.
And higher rates of alcoholism and substance use. The fear of discrimination also holds them back.
And then they're also not accessing support services that they would benefit from. So things like Meals on Wheels, services through the Alzheimer's Association, home care. Again, because you just don't know, is the person that's coming into my home going to be accepting of me as an individual? Even right now here in Michigan, it is not illegal to discriminate against someone in healthcare, in housing, based on their sexual orientation.
That discrimination is something that people carry with them their entire lives, Bushnell says.
In fact, 30% of the LGBTQ+ community feel the need to go back into the closet.
Which leads to extreme isolation, Pierce says. Both say the way around all of this is for people in businesses and organizations to expand their definition of what a family is and be accepting of who they are.
We should be considering seeking training for those in our industry to better understand where we're coming from, some of the fears that we might be facing.
So when I asked them other ways that people can be helpful, they say that by creating support groups for LGBTQ+ caregivers can be so important. Knowing that you are supported during these challenging times is very helpful. And they also say just by asking people their pronouns, it's another way to show that you care about their community and what they're going through. Reporting here in Grand Rapids, Lauren Edwards, Fox 17 News.